So when your labor starts, how will you tell that it's progressing? Okay, because that's really important, and especially if you want to get to your hospital or to the birth center or get your midwife to come if you're having a home birth. So labor tends to have a very slow start. Yeah, it's a marathon, remember? Very slow start, and the contractions are very mild. Like they last very short, mostly under 30 seconds, and will be the kind of pain that you can even carry on with your work or carry on with whatever you're doing, and you can ignore it to some extent. And they are very spaced out. So you have one contraction now, and you can have a break of more than 10 minutes and sometimes even hours in between the two. So how you know it's progressing is because you have the start of very mild contractions that you can talk through, that are lasting very short and are really spaced out, and that keeps with time changing to where your contractions are lasting longer and coming sooner and getting more intense. Now let me address something. There is a belief that if you have cramps or you have a lot of menstrual pain during your periods, that you will have a very gentle time or a very easy time when you're in labor. And busted, it's a myth. The truth is you will go through labor like every other woman, just that we have realized that a lot of women who have menstrual cramps, because they kind of have that experience, find labor a little easier, simply because the feeling of cramps is a lot more intense than the contractions, because contractions give you a break in between. So you will just, it helps to some extent. Let me not just make it so plain. It does help. But anyway, back to the progression, you will be able to tell, because now that change, you appreciate that change over time. Now you will get to a place where the contractions are lasting more than 30 seconds and they're probably coming under 10 minutes. Yeah, and you have to stop to breathe and or focus on the contraction. That shows you progress. Remember, it was very mild and very, almost you could ignore it, but now it's intense. So that is what will show you progress in labor. And if you have a doula, you have a midwife, you have your doctor, that's now how you explain to them. When they ask you how is the progress, that's how you tell them, and you appreciate the progress that way. Now, for especially dads, we have a lot of apps that you can download that will help you to time the contractions, and they're really helpful because some of them even give you a summary of how it's been in the last hour, and you can copy and paste, send that on WhatsApp to your midwife or doula or your doctor, or email it just so that they can see what the progress is like. But let me just point out that if you're using an app, you need to start or to press start when the contraction starts. So here's the thing, it starts, you can feel the pain coming from far, and then it starts to build. So that's around the time you press start. And then when it ends, it doesn't end completely, it lingers on for a couple of seconds. So you press stop when it stops. Forget the lingering part. So the lingering part at the beginning and at the end should be out of your timing, because sometimes they make you think the contractions are lasting longer than they actually are. And the mom, you would be able to tell exactly when it starts and when it finishes. However, sometimes it's not so easy to tell when your contractions are needing to be timed. But here's a hint. When you get to that place where now you're needing to pay attention to the contraction, then that's your best time to start timing it. And then you'll also have noticed the progression, and you stop to think, I think these contractions are a lot more painful, or they're lasting longer than they were, or they're coming sooner than they were. Now, this is very helpful, especially for dads. And the reason why I throw in dads into all these mathematical equations kind of things is because dads tend to take care of the logistics around birth more than the moms do. I mean, the mom is just focusing on what she's going through, so dad is on who wants to figure out all the rest. And so dads, how you will tell when you need her in the hospital or at the birth center or need the midwife to come over is when she hits what we call the 5-1-1 rule. That means she has contractions that are 5 minutes apart. So from the end of one contraction to the beginning of the other is 5 minutes. And every contraction is lasting 1 minute, or at least as close to a minute as possible, 45 seconds and above. And then if that goes on consistently for an hour, it's time to head. Yeah, or your midwife should be home if you're having a home birth. Now, it is possible to have contractions that last a whole minute, but they're not 5 minutes apart, they're longer, they're spaced out. So they're lasting a minute, but maybe they're about 9 minutes apart. So then you know you've achieved the first, which is one of the steps. Now you're waiting for the 5. Okay, so you can have the contractions last 1 minute, 1 minute, 1 minute until they get to 5 minutes apart, and that goes on for 1 hour. Then that's your exit. Again, you can start with contractions that are coming every 5 minutes, but they're only lasting 20, 30, 40 seconds. So then you have to wait till the 1 minute, till they hit 1 minute. And that's why the last one, the 1 hour at the end of the 5-1-1 rule is important, because you have to wait till that pattern is established. 5 minutes apart, 1 minute lasting. If that goes on for 1 hour, then you can head out. And by that time, moms, you are really needing extra help to cope with that. You actually feel, if you're at home, you feel, okay, now I need to get out and go somewhere. So that's the best time to go. Now, it's important for you to anticipate that, but at the same time, just relax through the whole process. Try as much as possible to calm down. At the early part of labor, while the contractions are still short and very mild, please ignore them. And I mean it, ignore them. Carry on with your day as long as you don't tire yourself. And because labor loves the evening, night and early morning, please sleep. It is not called labor for nothing. It's a lot of hard work. So you need to keep your body well hydrated, well nourished and rested. Those 3 will actually help you be able to cope with labor when it gets established. We wish you all the best. Please look forward to your labor, because honestly, there's no reverse gear. We are happy at Evesmama to walk with you during your labor, during your birth, and even during your pregnancy. And I really like, especially, do I say it myself? We as midwives, doulas, do pay attention to the support that a mom needs to be able to manage her own labor. And that is one of the things we do. So please visit us. We can talk about it. We can give you the details of how we work. As doulas, as midwives, as childbirth educators, we are very happy to hold your hand and work with you. Thank you.